Good morning, everyone. Welcome back to the 4th Annual Michigan Harm Reduction Summit, and welcome to those of you just joining us today. This is Brandon Houle, Harm Reduction Analyst with the Michigan Department of Health and Human Services. I just got a few quick housekeeping tasks for you before we get started. Again, you are greatly encouraged to participate in the sessions through the chat and the Q&A feature. We just ask that you keep your comments and questions respectful. Guidelines will be posted in each session for those chats. Evaluations, we appreciate any feedback we can get for this event. We're always trying to improve. You'll also need to complete the evaluation if you're expecting to receive continuing education credits. Those evaluations will be emailed after the conclusion of the entire event. There is a networking feature that we encourage you to take advantage of. That'll be available during breaks. It's going to be the people icon on the left of your screen. That will connect you to a random attendee for 1 to 5 minutes with the option to extend your time. So please take advantage of that feature, get a chance to meet some new people. And so without further ado, it is my great pleasure to introduce Teresa Juridico. Teresa Juridico is a viral hepatitis prevention coordinator with the Michigan Department of Health and Human Services Division of Communicable Disease. In her role, she coordinates activities to increase hepatitis C testing and linkage to care and provides support to the We Treat Hep C initiative, which aims to eliminate hepatitis C by increasing access to curative hepatitis C treatment. Teresa has been in her role since 2017 and holds a master's degree in public health from Des Moines University. And again, warm welcome to Teresa Juridico.
Thank you so much, Brandon. Good morning, everyone. So as Brandon mentioned, today I will be providing an MDHHS update on the department's We Treat Hep C initiative. So before I begin, I did want to just quickly share this financial disclosure. I declare that I have no relevant financial relationships with any ineligible companies. So today I will be covering CDC's universal hepatitis C testing recommendations. I'll be providing an overview of the We Treat Hep C initiative and then highlight some of the data that we track, which measures 1 year of progress through the We Treat Hep C initiative. So in case you aren't familiar with hepatitis C is a liver infection. It's caused by the hepatitis C virus and it's spread through contact with blood from an infected person. In April 2020, CDC actually updated their hepatitis C testing recommendations, and they actually expanded it from originally recommending testing among persons born from 1945 to 1965, more commonly known as that baby boomer cohort, to now recommending universal hepatitis C testing among all adults 18 years of age and older, and that's at least once in a person's lifetime. And that's most likely due to the rise of cases of hepatitis C in young adults. And then CDC also now recommends hepatitis C testing among all pregnant people during every pregnancy, and that's regardless of age. And this is due to the fact that, again, there's a rise of hepatitis C in young adults, specifically of childbearing age, but also hepatitis C can be perinatally transmitted from mother to baby during the birthing process, and that actually occurs in about 5 to 15% of pregnancies. CDC does still retain some of their prior hepatitis C testing recommendations related to recognized conditions, exposures, and risk factors. So they do recommend one-time hepatitis C testing, and that's regardless of age or prevalence among persons with HIV, people who have ever injected drugs or shared needles, syringes, or other drug preparation equipment. And that includes people who might have injected only once, or individuals who might have said, hey, well, I injected a few times, but that was many years ago. Those individuals should still receive one-time hepatitis C testing. And then again, children born to mothers with hepatitis C infection should receive hepatitis C testing as well. CDC also continues to recommend routine periodic testing for individuals who have ongoing risk factors while those risk factors persist. So again, people who inject drugs and share needles, syringes, or other drug preparation equipment, and then individuals with select medical conditions, such as if they've ever received maintenance hemodialysis. And then finally, the CDC states that really any person who requests hepatitis C testing should receive it. And that's regardless of disclosure of risk, because individuals might be reluctant to share or disclose any risk due to fear of stigma that they might face as a result of it. So there are treatments that are available to cure an individual of their hepatitis C infection, and those treatments are called direct-acting antivirals, or DAAs. So DAAs first received approval by FDA in 2013, and it's important to note that these medications are a major improvement over previous hepatitis C treatments such as interferon. They're much more simple, effective, short in duration, and actually they're pretty well tolerated. They are all oral medications taken once daily for as little as 8 to 12 weeks. And the cure rates are great. They're greater than 95%. They can improve health outcomes, reducing the risk of decompensated cirrhosis as well as liver-related death. However, since hepatitis C is a fairly prevalent condition, however, payers did have to strategize on how they would curtail costs without having an infinite budget. So in this instance, payers such as Michigan Medicaid set restrictions on hepatitis C treatment due to a limited budget. So formal coverage of direct-acting antivirals was initiated in January 2016. And in order to receive Medicaid coverage of hepatitis C DAAs, a person had to have a fibrosis score or a liver damage score of F3 or F4, indicating severe liver damage. And then the prescription had to be written by a specialist, such as an infectious disease doctor, a hepatologist, or a gastroenterologist. And then finally, the patient had to demonstrate 6 months of sobriety. There were also prior authorization requirements put into place, which meant that in order to gain approval for writing a script, the provider had to submit paperwork beforehand. So in 2017, the fibrosis score restriction was actually lowered to F2, indicating moderate liver damage. And then as part of a settlement of a class action lawsuit against the department, the fibrosis score was lowered to F1 in October 2018. And then in October 2019, the fibrosis score requirement was removed completely. So while there was some progress that was made with regard to removal of the fibrosis score requirement, the prescriber requirement, the sobriety requirement, as well as the prior authorization requirement still remained. So to address the remaining requirements so that we could increase access to hepatitis C treatment and eliminate hepatitis C in Michigan, MDHHS launched the We Treat Hep C initiative on April 1st, 2021. So through that initiative, we entered into an agreement with AbbVie, who is the manufacturer of glecaprevir pibrentasvir, which has helped us remove barriers to prescribing and increase access to hepatitis C treatment among all Medicaid and Healthy Michigan plan beneficiaries. So as part of the initiative, glecaprevir pibrentasvir has become the preferred product and no longer requires prior authorization as of April 1st, 2021. So providers no longer need to submit paperwork or prior authorization in order to gain approval for writing a script of glecaprevir pibrentasvir. So for non-preferred DAAs, prior authorization requirements still do exist, but those prior authorization requirements have been streamlined. In the past, the prior authorization requirements in terms of the paperwork, I want to say was about 6 to 8 pages long. Now the paperwork has been reduced to only 2 pages and really just asks why the preferred product isn't clinically appropriate for the patient receiving hepatitis C treatment. And then the other existing DAA restrictions that I referred to earlier in the presentation, so the sobriety requirement and the specialist requirement, those have been removed for all direct-acting antivirals through Michigan Medicaid. So through the initiative, really any prescriber with prescriptive authority can treat hepatitis C. And the success of the program is highly dependent on getting more providers to treat hepatitis C. And since treatment was historically limited to the specialists like the infectious disease physicians, gastroenterologists, and hepatologists, a focus of ours has been to increase the clinical capacity of providers to treat hepatitis C. So in order to expand clinical capacity, we contracted with Henry Ford Health System and Wayne State University to offer complimentary clinical consultation for healthcare providers. They can also offer on-demand didactic webinars, live training events, and case discussions. One of our partners, the Michigan Opioid Collaborative, they also offer bi-weekly hepatitis C education and case consultation in order to support primary care or any community providers with diagnosis, treatment planning, or medication management of people living with hepatitis C. And then we also frequently share additional trainings and resources as they become available on our website, which is michigan.gov/WeTreatHepC. And then we also do maintain a We Treat Hep C listserv through GovDelivery, where we disseminate new updates regarding the initiative or new trainings. So if you are interested in subscribing, please feel free to email us at our email here, mdhhs-hepatitis@michigan.gov, and we'd be happy to add you. You can also find our hepatitis C treatment provider map and directory on our We Treat Hep C website, which serves as a resource for individuals with hepatitis C in order to find providers near them that treat hepatitis C. On the left-hand side image here, you can see that there's this interactive map on our website to the left, or we also have a print-friendly directory to the right that lists out providers by county. And we are always looking to update this resource. So if there might be a provider who treats hepatitis C who's not listed, or you are a provider who treats hepatitis C and would like to be added, please feel free to contact us through our email address, which we've listed on our website as well. So as I mentioned, the We Treat Hep C initiative has been in progress for about a year now since we initially launched it. And I did want to share some of the data that we are tracking. So this slide demonstrates Medicaid beneficiaries tested by month from 2018 to 2022 in Michigan. So from March to June 2020 was when the stay home, stay safe order effect went into place, which impacted the number of beneficiaries being tested for hepatitis C. April 2020 was also when CDC published their universal hepatitis C testing recommendations, which was overshadowed by the pandemic. And then in April 2021 was when we launched We Treat Hep C. When you look at claims from the most recent months, these are provisional and they're subject to change. But you can see when comparing the testing numbers conducted in 2018 to 2020 compared to more recent months after the launch of We Treat Hep C, you'll see that testing has been higher. So this slide demonstrates the number of Medicaid beneficiaries that have started treatment from 2018 to 2022. So in October 2018 was when that fibrosis score requirement was lowered to F1, and you see a slight spike in hepatitis C treatment starts. And then we see a much larger spike in October 2019 when that fibrosis score requirement was removed completely. Again, the stay home, stay safe order was in effect from March to June, which did seem to impact some of the hepatitis C treatment starts. And then we see another spike in April 2021 when We Treat Hep C was launched. And this was also when the prescriber and the sobriety restrictions were removed as well. Similar to the last graph, the claims from the most recent months are provisional. Again, if you compare the numbers, treatment rates are slightly higher than compared to 2018 and 2019, but there's definitely still room for improvement to get folks treated for hepatitis C. So this graph demonstrates hepatitis C treatment providers prescribing treatment for Medicaid beneficiaries each quarter during that same time frame. So when we're looking by quarter, the number of hepatitis C treatment providers typically is hover around 140 to 160 per quarter. However, when looking at the most recent quarters here, we've seen over 200 prescribers prescribing Hep C treatment for Medicaid beneficiaries, which is definitely encouraging. And we'd like to see that trend continue to move upwards. And then this is the cumulative total of new providers who prescribe Hep C treatment for Medicaid beneficiaries. Similarly, we've continued to see a steady increase of new hepatitis C treatment providers over time. And again, it's a trend that we'd like to see continue moving forward. So just to summarize, since April 2021, we have added 186 new hepatitis C treatment providers. We've treated nearly 2,000 total Medicaid beneficiaries for hepatitis C, and we've been able to increase the Medicaid hepatitis C testing rate from 26% to 29%. And again, we'd love to see these numbers continue to increase going into year 2. But just to summarize some main takeaways on what you can do to help. One is to optimize Hep C testing. So if you haven't already, implementing the new universal Hep C testing recommendations. As you may know, people who are infected with hepatitis C, they're often asymptomatic, and a person might not know they're infected if they aren't tested. And there are curative treatments available, so there's really no reason why anyone has to live with or die from hepatitis C. And then incorporating opt-out hepatitis C testing, where all patients get tested, but individuals have the opportunity to decline. And the advantages to that is that it normalizes testing and reduces stigma. And then if you are doing testing, making sure that you're employing hepatitis C reflex testing. So making sure that individuals are getting both the hepatitis C antibody test and the hepatitis C RNA test to confirm active infection. And this helps reduce incomplete testing. It reduces patient barriers from having to return for a secondary blood draw. And then it facilitates earlier linkage to treatment. And then finally, raising awareness of Hep C and We Treat Hep C, whether that's through sharing educational materials, putting out messaging on your social media platforms, messaging through any newsletters or to your stakeholders, or posting on your website. And then if you do have prescriptive authority, consider treating hepatitis C. Again, we, as I mentioned, there was those complementary clinical consultation programs that I mentioned. And we also have some simplified treatment guidelines on our website as well. And then finally, just making sure that if you are treating hepatitis C, that you're writing prescriptions to dispense the full treatment course to promote medication adherence. And I just want to thank you for your time and attention. I know that I'm slightly over. I do have my contact information here if you would like to reach out to me with any questions you have. It sounds like now we will be moving over to breakout sessions. So if you wanted to navigate to the reception page on the left-hand side toolbar, you can see what the next sessions are. Thank you, everyone.